All right, guys, how's everyone doing? All right. Just a brief lecture tonight, not too intense. Friday night, so we're not gonna do too much. Okay, not too much. All right. If you guys have any requests or anything, I will put my information. I put my information on the very last slide. All right. So for legal purposes, I just want to make sure that you guys read the disclaimer. All right. Hello, everyone. It's good to see you guys. All right. So this is a disclaimer. Just make sure that you guys know. All right. Read over this. It's not for medical purposes. All right. You always want to seek the advice of your physician or other qualified healthcare providers. And the views, thoughts, and opinions expressed in the text belong solely to the author and not necessarily to the author's employer, organization, committee, or other group or individuals. So just so you guys know that. All right. And tonight, guys, we're going to kind of hammer facility protocols. So this is a big deal for leadership and management. Believe it or not, leadership and management, it's a heavy part. It's the biggest portion of your NCLEX, your exit exams. So we're going to talk about some facility protocols tonight. All right. All right. So the first topic that we'll discuss, incident reports. All right. The related content, the underlying facts, nursing interventions, when, why, and how. So this is why, guys, as nurses, keep in mind, we're nurses. So everything you want to ask yourself, okay, what does this have to do with nursing? When, why, how? As a nurse, how does this apply to me? So nursing interventions, guys, are extremely important, even with incident reports. All right. So just keep that in mind. All right. So we're going to talk about the related content. Injury incident report form. Heavy hitter. Okay. Heavy hitter for your exit and your NCLEX. An injury report form has to be completed. Okay. After any occurrence which is not consistent with routine operation of the facility, of the service provided, routine care of a person receiving care or support. So if something is inconsistent, something that doesn't follow the standards of care, if something occurs, you have to keep in mind, I need to do an incident report. Okay? One way to remember an incident report, just keep in mind, guys, this is not for punitive measures. An incident report is something that you want the facility to know about so it doesn't happen again. So they can put some type of procedures or policies in place so that doesn't happen again. All right. So any occurrence which is not consistent with routine operation of the facility. Okay. Something that occurs with the facility, maybe a bed, maybe there was some type of one time I was taking care of a patient and the bed just exploded. Like the bed, literally the power just went out on the bed. You know, the power just left it. The bed just stopped working mid care. When I was giving care, the bed stopped working. All the electricity just died in the bed, you know? Service. If there's a service, something that you're providing care and something went wrong, something that doesn't normally happen. Routine care of a person receiving care or support. So if something leads to an adverse effect, okay, while or after receiving care or support, Remember, guys, you have to do an incident report. Always keep in mind it's not for punishment. It is for you and the facility to prevent an incident from happening again. So I want you to keep that in mind. All right. Related content, injury incident report form. Okay. All right. Now, this is one thing that you have to keep in mind. If you complete the incident report correctly, if the facility handles the incident report correctly, guess what? In some states, it cannot be subpoenaed if properly protected by the provider in the facility. So this incident report is truly for the safety of the patient, for the safety of the facility. We always participate in quality improvement as nurses, guys. So always think of the incident report form in that manner. Okay, it's not supposed to be punitive. Okay, incident reports cannot be subpoenaed if properly protected by the provider in the facility. Okay, now underlining facts. When should the nurse file an incident report? All right. So when should she file it? Medication errors. Guess what? Wrong patient, wrong drug. A paralytic was administered instead of an antacid. Wrong dose, wrong time, wrong route, wrong documentation. Okay. So when should the nurse file an incident report? Whenever a medication error occurs. And remember, this goes to your risk management. When should the nurse file an incident report? Okay. Procedure, treatment error, cancer treatment for the wrong patient. File the incident report. Okay. File the incident report. Equipment. Let's talk about malfunctioning equipment or other related injuries or errors. Asking a physically impaired client to step up to the exam table on a stool and the stool slips, you need to file an incident report. Okay? You need to file an incident report. That's malfunctioning equipment or other related injuries, guys. You need to file an incident report. Needle stick injuries, of course, you must file an incident report because maybe that safety device or safety needle is not as safe as the manufacturer says it is. Okay? Let someone know how they can avoid getting a needle stick injury. File the incident report. Falls, guys. Whenever there's a fall, it may be a visitor. Okay? It may be another employee. It may be a coworker. Okay? You may fall. A patient falls. You must fill out an incident report because, again, maybe there's something that the facility can do to prevent this from ever occurring again. All right? So when should you file an incident report? Falls. When should you file an incident report? Visitors or volunteer is injured. Whenever this occurs, guys, you need to make sure that you let the patient, make sure the patient is safe first, or make sure the visitor and the injured person, the volunteer, make sure they're okay first. All right. But don't let them leave the site. Don't let them leave the location without getting all the information that you need for an incident report. Because, again, maybe we can prevent this from occurring again. So I want you to keep that in mind. Threat made to the client or staff. File an incident report. Okay. How can we protect our staff better? Maybe they may decide, you know what? This has been occurring so much. Our staff is being threatened so much, okay, that we need to install some cameras. Or maybe we need to get a code access to this unit because this is occurring a lot. So fill out an incident report. And loss of property. If you have a patient, guys, who loses hearing aids, cell phones, money, home medications, some of these medications are very expensive, guys. Wheelchairs, fill out an incident report. Any equipment that the patient brings from home and the patient loses at the facility, make sure you fill out an incident report. Again, maybe the facility can do something to prevent this from ever occurring again. Okay, nursing interventions. When? Okay. Nursing role in reporting incidents. So we just had a few, we discussed a few specific incidents. So let's continue. Let's talk about it is the nurse's responsibility to report an incident or injury for the following individuals in healthcare facility. You have to report an injury if it involves a patient, a coworker, volunteers, or visitors, guys. Don't let them leave the area. Make sure they are safe. Make sure they are okay, and get all the information you need. Remember, this is for the facility. This is not to be subpoenaed. If you handle it the correct way, risk managers handle it correct way, it can't be subpoenaed. It is for the facility. So make sure that you fill out an incident report. Nursing interventions, why? Okay? Why? And you can also put how. Well, we must provide objective information about the incident. Okay? Why? The report is going to be used to prevent this from occurring again. You don't want to be the nursing supervisor and every week it's the same incident and no one is fixing it. So this is why the report will be investigated as to prevent this incident from occurring again. And remember, it's not a tool for blame or liability. That's not the purpose. Okay? So incident report. Now, how do I fill this out? Okay, if I'm in a rush, if I'm exhausted, okay, very stressed, these are some of the things that you have to put into the incident report, because what if there's not a form available? All right, but most facilities, they have a form. But for you nursing students that are preparing for the exit, let me tell you some things that you must include. Okay, client's name. You want to put the room number and put the person completing the report, which is you. All right, the name, room number. All right, keep that there. All right, now if this involves a visitor, make sure you put the visitor's name, the visitor's phone number, and the visitor's address. All of these things you want to include in your incident report: the address, phone number, the name. All right. Make sure that you have the time, the date, and the location. Okay. The time, the date, and the location. The incident report has to be complete with objective and factual descriptions of the incident. Okay? Objective and factual descriptions of the injury. Objective and factual description of the cause or precipitating factors. We don't say found patient fell on the floor. No, we say found patient in the supine position, found patient in the, maybe you can say in the sitting position. You don't say fall. You're being objective. When you walked into the room, what did you see? Okay? Objective, factual information. All right? And you want to make sure you have the description and the cause of the precipitating factors. All right? If there is a witness, okay? If there's a witness, make sure you have the name, the address, the department. If the patient works in radiology, make sure you put the name and the radiology department. Okay? If the employee works in the laboratory, make sure you put his name and that he works in the laboratory. And also write down factual, objective witness observations. So you just basically want them to tell you what they saw or what they witnessed as well. All right, make sure that's in your incident report. Okay, actions taken. What did you do? Who did you call? Okay, what type of care did you provide? What type of therapeutic communication did you provide? What type of assessment did you provide? What physician was notified? If there's a fall, you need to notify that physician. Okay? Prescribe referrals. Was the patient giving a referral? Was the visitor giving a referral? Was the coworker giving a referral? And prescribe consultations, guys. What if there was a patient? Okay, what if there was a patient that fell and broke his hip? Okay, surgery has to be consulted. All right. And we found a patient in the sitting position, and we discovered upon assessment that the patient had pain in the right area, the right upper torso area, in the hip area, the hip region. And then we discovered after the patient went to CT or MRI, because the doctor will say, send the patient to CT or MRI. And we discovered that the patient has a broken hip. Surgery has to be consulted. So these are all some of the things that we have to put in our incident report. Okay? So remember, reporting incidents, actions taken, physician notified, prescribe referrals, prescribe consultations. So these are all some of the things that you definitely want to put in your incident report. All right. Nursing interventions, reporting incidents, report the equipment, guys. All right. If it was a bed, if it was a bed scale, if it was TED holes, because some people don't remove TED holes when they should remove the TED holes. SCDs. Sometimes patients walk around with the SCDs and they forget to unplug them from the actual device. Okay. If it was a medication, if there's an incident with medication, write the name and the dose given. Okay. So all of these things, guys, you have to write on your incident report. All right. Now, for the second topic, you have disaster planning and emergency response. Big deal, guys. Disaster planning and emergency response is a huge deal especially on your exit and your NCLEX. All right. Remember, your NCLEX is computer adaptive. So if you don't know a certain area that they consider a heavy hitter, according to you can find out what's a heavy hitter. You can look at your 2019 NSCBN test plan, and you'll find that disaster planning and emergency response is there. I know it's not cardiovascular. I know it's not GI. But guess what? If you don't study your disaster planning and emergency response, the NCLEX is adaptive. They're going to keep giving you these same questions over and over again. So everything is important, and this is a heavy hitter. All right. So I want you to make sure that you review this, pretty much review it as much as you can. All right. So now, underlining facts, disaster planning and emergency response. So emergency operation plan. All right. So this provides the structure and processes that organizations use to respond to and initially recover from an internal or external disaster. So it can be something that the hospital is preparing. They're in preparation. They know that, okay, they may be some internal disasters. There may be some external disasters where the hospital, so we have to make sure that we have everything we need in place just in case these things do occur. I mean, we're a hospital. All right. So we have to have an emergency operations plan, because when there's an internal disaster or an external disaster, people, clients, patients are going to come to the hospital. So we have to make sure that we have something ready for them. Okay, we have to plan for these things. Internal disasters happen, external disasters happen. So it is the responsibility of the hospital to ensure that they have an emergency operation plan. It should be tested at the minimum of twice a year, the minimum. Okay, they have to test it at least twice a year. And the emergency operation plan, it must align, or it must be parallel or interface with local, state, and federal resources. Okay, they can't make an emergency operation plan and they don't make sure that it doesn't align with federal, local, or state. It's not going to work. Okay, so the emergency response provides overall authority, roles, and functions. So this is very important. So when these emergencies or these internal disasters or external disasters occur, everyone will know their role. Everyone will have a role. Assigns responsibilities for specific actions. Establish line of authority. Okay, a line of authority. So as a nurse, for this one, guys, for this particular slide, I want you to think, I want you to brainstorm, what is my role as a nurse? If I were a part of one of these teams, what role could I be? What role could I play? And believe me, guys, we participate in pretty much everything. There's a nurse somewhere in the mix. Okay? So these emergency plans, they let everyone know, okay, you are the authority figure for this particular situation. They're going to assign responsibilities. They're going to give the nurse specific actions. Okay? What is the nurse's role? What is the integral part in this emergency operation plan? What can you anticipate your role? What do you think that you'll be very good at when you guys start working in the hospital? Okay? Because we are a part of the emergency response plan. So these are the types of emergency situations. So remember, there's internal and external. All right? Internal and external. And the hospital has to be prepared for it. Look at it. It even says mudslides. Can you imagine being on an emergency response team for a mudslide? But guess what? If that is something that plagues that community, that hospital needs to be ready for it. Okay? Plane crash, vehicle accidents, the flu, pandemic. Now we're dealing with corona. So the hospitals have to develop these emergency response plans, emergency operational plans, EOP. All right. These are the local, state, and federal disaster response agencies. All right. Remember, whatever the hospital does with the emergency operation plan, they have to align. They have to make sure that they align and interface with these local, state, and federal agencies. Otherwise, it's not going to work. So they're in constant contact with each other. So we have the FEMA, we have Department of Homeland Security. Don't forget the American Red Cross, guys. Office of Emergency Management, Florida Department of Health. So you have all of these underlining facts. These are the local, state, and federal disaster response agencies. And believe it or not, they want you as a nurse to be aware that they do exist. All right. So the key roles in the emergency operation plan. The key roles. Which role could be fulfilled by a nurse? So let's see. Okay? Because there are quite a few roles. First of all, they're going to activate the hospital incident command system. They're going to establish an emergency operations center. And they're going to assign a hospital incident commander. Okay? A hospital incident commander. They need someone that they can talk to. All right? They need someone, okay, this is the guy that I know that they're going to give us the best instruction. All right? If I need to know what's really going on, I need to get the information from him, because sometimes, guys, it can be chaos. Okay? So they need that hospital incident command system. They need an emergency operations center, and they need a hospital incident commander. This is one person that you know, okay, whatever he says, this is what I'm going to follow. It's coming directly from him. All right? There can be a medical command physician, communications officer, guys, triage officer. So I really want to discuss this triage officer. The triage officer is extremely important when it comes to these mass casualty events, these external disasters, because, guys, we don't want to waste resources on people that are not going to make it. The patients that we consider to be black tags. So the triage is essential, okay? And that role could be held by a nurse, a triage officer, all right? Because remember, during a disaster, they're not going to waste resources on patients that they know won't make it. It's a different criteria. It's usual conditions, and then there's conditions of mass casualty incidents. So as nurses, we triage different in both situations, and we'll discuss that a little more. Okay, but these are all the key roles in the emergency operation plan. Okay, so just think about, which role do you think could be fulfilled by a nurse? Okay, guys, so just keep that in mind. All right. Now, if a nurse is designated, if she is assigned to a disaster team, the nurse has to follow these recommendations. She has to be ready. So she won't just find out like, oh, 5 minutes after the disaster started, they won't say, oh, you are on the disaster team. This is something that is planned. Because remember, this has to a mock emergency response plan has to take place twice a year. So everyone should know their roles. All right. So if you are assigned to a disaster team, the nurse should follow these recommendations. So you should already have child care in order, pet care. You should have your identification card. You need to have your professional licenses. You need to have your health insurance cards, because if you have to go, remember, you have to go. So you have to make sure, if you have children, they have child care. If you have a pet, they have pet care. All right. Make sure that you have your basic supplies. All right. Cell phone, charger, emergency blanket, sleeping bag, pillow, first aid kit, over-the-counter prescriptions, and toiletries. Because remember, you got to go when it's time to go. If you sign up for these teams, you have to go. You have to be there. You have to be able to take care of the community. All right. So you have to be ready. All right. So the mass casualty triage, what you are basically preparing for and what you are known, you know how to handle this mass casualty situations. All right. So remember, there's triage under usual conditions and there's triage under mass casualty conditions. So if you're going to be that triage nurse, guess what you're going to be doing? You have to know how to tag the victims of these incidents. So you have to know what a red tag, all right, yellow tag, green tag, and a black tag. Okay, this is something that you will be expected to know if you are going to be a triage nurse. You see how it's different. Triage under usual conditions is completely different from triage under mass casualty conditions. Very different. So I have embedded a video here. So if you guys, the PowerPoint will be in the description box. So you guys can just click mass casualty triage, and there's a very good video that breaks down the different tags. It's a real scenario. All right. So it'll help you guys, especially if you're a visual learner, it'll help you understand the tags. You must know this. This is a big deal. So I want you guys to make sure that you look at this video and that you really pay attention to this slide and review this slide. This is a very important slide. All right. Nursing interventions, guys. Discharge, relocation of clients. So let's say if you are a charge nurse in a facility and they say, listen, we have to discharge some of these clients. Whoever can be discharged, we need to discharge them now because we have some really critical patients coming in. We need this room. But as a nurse, as a charge nurse, you have to know, okay, I can discharge this patient. I can discharge this patient. I can discharge this patient. But I cannot discharge an unstable patient. All right. I cannot discharge a client requiring continuous nursing care. Okay, you can go home. You can go home. You can go home. But this client cannot go home. So this is what the charge nurse will do. They will call her on the floor and they'll say, listen, we have a external disaster and we need the brooms. We need the rooms. We need the beds. Okay, so who can you discharge and who can stay? And as a nurse, with your triage experience, your charge nurse triage experience, you have to say, okay, this patient can be discharged. This patient can be discharged. This patient absolutely has to stay. Okay, so that's a part of the responsibility as a nurse charge nurse. All right, discharge relocation. And then our third topic, guys, are the different types of emergencies. So this will tell you why the patient is here. Like what type of emergency occurred? What brings you here today? What disaster occurred that brings you to the hospital today? So there's different types of emergencies. Okay? There's biological emergencies. Now, as a nurse, and I want you guys to write this down. As a nurse, this affects you. Because remember, you're going to be taking care of this patient who has been exposed to this biological emergency, anthrax. So this affects you. It may be the anthrax that affects the respiratory, the lungs, or it may be the anthrax that affects the patient's skin. And one thing I want you guys to remember that I see a lot is remember that Cipro is what they give for anthrax that affects the skin. Cutaneous anthrax. Please remember that Cipro is what they will give the patient to treat this illness. Okay, make sure you remember that. And guys, for all of these biological emergencies, anthrax, smallpox, botulism, plague, please remember that you must absolutely have to do a concept map. They're going to hit you hard with these. So I want you guys to write down, I will do a concept map for my biological emergencies. And make sure, guys, you know how to treat it. Okay, this is a big deal. Okay, this is a huge deal. So biological emergencies, guys, it's anthrax, smallpox, botulism, plague, and tularemia. I read about that. It's from rodents, and if you go to the CDC, you can read all about it. I'll add the link to the description box. So these are biological emergencies, and I want you guys to please complete a system disorder concept map for all of them, because you definitely don't want to get these questions wrong. They're going to hit you with the treatment for each one. They want you to know how you treat it. Okay, so make sure you remember that. And chemical incidents, if there's a chemical incident, there's some chemicals that we can, use running water to remove it from the client, from the patient. But some agents like lye, you must brush off. You don't want to put water on lye. So removing agent by brushing off the dry powdery chemical. So some agents you can use running water. Some agents, guys, you have to brush it off. Hazardous material incidents, nursing interventions. All right. One thing that you will have to know is the donning and doffing of your PPE. So how do we help ourselves? So I guess this is more so nurse centered. If I have a patient who is exposed to some type of hazardous material, I must make sure before I can take care of this patient, I know how to don my equipment. So donning, you put your gown first, your mask, your goggles, and then your gloves. All right. You have to be very careful, guys. All right. When doffing, because when you're doffing the PPE, when you're removing it, you kind of don't want to shake it out. You want to roll it off of you. Very meticulous, very careful removal, because you don't want the hazardous material to become airborne. You want to try to contain it. That's why we roll sheets, we roll our gown, because you don't want the hazardous material to become airborne. And this is the proper procedure for doffing PPE. Don't forget that. Okay. Radiological incidents. Okay, guys. They may be working in an environment or a country, and there's a radiological incident. So for you, if you're going to work in this environment, if you're going to help the patients that have been exposed to some type of radiological crisis or incident, okay, make sure that you have a radiation badge. All right. You need to be monitored. All right. Decontamination of the client should include soap, water, guys, and disposable towels. You have to throw those towels away. If you have a patient who has been exposed to some type of radiation, guys, make sure that you have a badge. Where's my badge? Okay. Make sure you have a badge. Make sure that if you're going to decontaminate the patient, you have soap, water, and you're using disposable towels. Okay. And those towels go in their special bags. All right. Security plans, guys. Security plans. Security plans. This is another topic. All right. Security plans, guys. Very important. Every hospital should conduct a risk assessment to protect the staff and provide the proper security measures. So every hospital, guys, they have to keep everyone secure, not just the nurses, not just the patients, the visitors, the family members, guys. There's children. So every hospital, guys, has to should conduct a risk assessment to protect the staff, provide the proper security measures. So that's parking lot theft. They should be aware of personal violence, infant abduction, cameras, entry codes. So these are all some things that the hospital has to, they have to perform this risk assessment. They can't have nurses walking to the car and then, getting accosted or getting assaulted by people and no one does anything, So security, make sure that as a nurse, guys, the underlying principles as a nurse, make sure that you are aware of the security risks also, so you can protect yourself. Okay. Make sure that you as a nurse, your role is to make sure that you understand the risk. All right. Make sure that you are not walking to the parking lot alone if they have a high incidence of, assaulting nurses or anyone in the parking lot theft. These are some of the things that you need to be aware of as a nurse, because not only can you educate yourself, but you can educate your clients as well. All right. So this is a role that we have to play. This is something that we have to make sure that we are aware of as nurses. And the last topic, guys, the fourth topic, the last topic, and we are finished with leadership and management. We're going to start medical surgical. All right. So the fourth topic, nursing roles and security measures. All right. So, guys, if you know that this is a lock unit, don't let people leave the door open, hold the door open. Sometimes people will put sticks in the door. As a nurse, if you know you work in a lock unit, you need to reinforce that lock unit. Okay. If they need to use a key code, tell them no, close the door, put your code in. Okay. Infant alarms, guys, mandatory. You know how devastating that can be if you work in OB and an infant is abducted. And security monitors and cameras. Make sure that they are working in your unit. If they are assigned to your unit, guys, they should be working. And if they're not, make sure that you let someone know. Fill out an incident report. Okay? Because we can't have our patients, our visitors, ourselves get hurt. So we are a part of this. This is our role. All right? Nursing interventions. We intervene when it comes to security measures as well. Underlining facts. Emergency designations. All right? I put a video here for you guys also. You have to know the colors. You have to know the codes. All right? So I put it here, and I also, if you click on the link where it says emergency designations, that's a nice video that you can watch over and over and over so you can become familiar with the codes. So because there's fire, there's a pink newborn infant child abduction. I've been in a hospital and I've heard that code go off. I've heard them, a code pink, guys, a code orange, code blue. Now, this is very important for you guys. Look at what a code blue is. Look at the code blue. All right. And code gray. I know you guys are familiar with this. Code gray and code black. Okay. This is very important that we as nurses, because we have to react in these situations. Okay. Imagine the tone, or imagine the looks on everyone's face when they heard that code pink. Can you imagine what a bunch of women were thinking? They were ready to fight. All right. So that code pink. So we hear these things throughout the hospital. We hear a code gray. If I hear a code gray and I know it's just me and Amy on the shift, I'm going to be like, wait a minute, code gray, who's doing something to Amy? So these are some of the things that, code red. This is how nurses, and not only us, but we protect our patients. Okay, we have to keep our patients safe. So if they are saying these things in the hospital on the intercom, guys, we have to react. All right. And then, believe it or not, guys, they love this question here. They love it. Especially on your exit. They love it. Okay. And they use so many descriptive terms. They turn this thing inside and out. Race and pass. But just remember, guys, rescue, alarm, confine, extinguish. It doesn't matter how many fluff words they put around it. They love to fluff it up. They love to put these descriptive words. They love to put all these synonyms. It doesn't matter. Rescue, alarm, confine, extinguish. Don't let them trick you. Okay? And pass, which is pull, aim, squeeze, sweep. Don't forget that, guys. Do not forget that. And they love to they put it on the exit. I see it on every exit, guys. For the last 4 years, I've seen this. And the students get very angry because it's like, they didn't say that. It's pull, aim, squeeze, and sweep. Okay? Write it out. Write it near the test item, or write it on your scrap paper, and stay true to that. It's pass and race. Bomb threat, guys. One thing they want you to do for the bomb threat as a nurse. If someone calls a bomb threat, they want you to stay on the phone with the person. They want you to talk to that person. because that will give them the opportunity to trace the call. The longer you're on the phone with the patient, they can trace it. Okay, so I put a video here for you. There's a video alert. You just click it, and there's a very good video for you visual learners. I'm a visual learner. So there's a very good video, but I want you to understand, guys, whenever there's a bomb threat, one thing they want you to do as a nurse, your role is to try to stay on the phone with that person as long as you can. That way they can trace it. They can trace the call. An active shooter situation. This is also in your material for school. Run, hide, fight. All right. First, they want you to run. Then they want you to hide. And if it goes down, then they want you to fight. All right. There's a video there, active shooter situation for your auditory visual learners. You just click on the link and it'll, just watch it over and over. They're no more than 4 minutes, and it will help you a lot. Run, hide, and fight. And these were my references. All right. Guys, if you have any questions or any requests, just email me at any time. And this is it, guys. We've read the entire leadership and management. We've covered pretty much all the heavy hitters. Go back and listen to the rest of the videos, but that is that. We finished one series, and now we'll start with physiological adaptation, which is med surg, which is going to take forever. All right, but we'll do it system by system. We'll start with neurological. We'll go to respiratory, cardiovascular, GI, which is very, very intense. GI is intense. GU, musculoskeletal, and skin. All right. That will be our next series. All right. Just email me and I will see you guys next week. All right, guys. Thank you for joining me, guys. Good night. Good night, everybody.